Hi, everyone. My name is Dr. Vidhi Thakkar, and I'm delighted to present the findings of my CIHR Health Systems Impact Fellowship. I'm funded by the Canadian Institutes of Health Research, and I'm also a co-funded MyTax Elevate postdoctoral fellow. Delighted to present the research insights from a scoping review on hospice-based program evaluations. I have the honor and privilege of working with Professor Kelly Stajdahar at the University of Victoria and Jonathan Schmid at the Victoria Hospice for an embedded research project. So our scoping review focused on palliative care programs and hospice-based palliative care programs, as well as the evaluation of these programs and how knowledge users at the hospice, as well as other organizations, can benefit from these programs. My research questions were: how have programs been designed for caregivers and implemented and evaluated in the hospice setting? What are the implications of these research findings for healthcare management, for healthcare professionals, policymakers, caregivers, and scientists? In terms of the methods, I applied the classical ARC-C and O'Malley framework, and in the true fashion of embedded research, we shared our findings with the knowledge users for ongoing program development, design, implementation, and evaluation. So in terms of our academic literature search and the gray literature search, for both, you can see the databases that were searched here in the poster, as well as some of the sources of gray literature. And the inclusion criteria was that we included articles focused on the design, implementation, and or evaluation of hospice-based programs for caregivers. In total, we had 50 articles that were included in our study, and the key findings of our scoping review showed that healthcare professionals can refer patients into these hospice-based programs to provide support for family caregivers within the community. And these types of community programs may also lead to an overall reduction of healthcare costs. Now, in terms of knowledge mobilization of these findings, these research findings have implications for healthcare professionals, and that referral into hospice-based programs for caregivers and family members can benefit the community, and also healthcare professionals can refer their patients into these programs so that patients have additional support from the hospice in terms of access to palliative care, bereavement counseling, and additional services provided by the hospice. In terms of implication for policymakers, there's health systems funding and financing implications, and we need to better consider how we design our healthcare facilities and hospices and consider the creation of a standards group. There's also implications for caregivers and academic researchers. So in a patient-oriented research approach, we engaged caregivers in our project steering committee throughout all aspects of this research project. And so academic researchers are interested in designing and implementing high-quality scientific research projects with older adults and caregivers to inform patient-oriented research approaches and to contribute to a steering committee. So these are the findings. I'm delighted to answer any questions and happy to answer any questions from the audience, and it would be great to connect with you at our conference. Thank you. Have a great day.